This video is part of the Massage Therapy Clinic lab notes for Stark State College. The instructor is Michael Vahila, licensed acupuncturist and licensed massage therapist. In the treatment on the arm, the hand is pronated when you go up the outside, supinated when you go up the inside. And this is what Kellogg would call centripetal friction. So the purpose of this is just to apply the lubricant. Also notice as I do this, I'm bending the knee. Then we go to the hand and fingers and kneading. So you're just compressing between the palms of your hand, the thenar eminence, and you're squeezing underneath. This is just compressing the palm. Then you're going to individually knead each finger in two ways, from anterior to posterior and side to side. Several things are happening here. It's like a coin shuffle technique where I'm using a considerable degree of pressure as I make that stroke, and I'm also tractioning the finger a little bit. You can switch hands to do some of the fingers with your other hand if that's more comfortable. Then you want to do the back of the hand, and between the metacarpals you're going to glide your thumbs 2 or 3 times through each set of metacarpals. And then for the palm of the hand, you want to raise the person's arm up at a 45-degree angle, and just with your thumbs, just deep friction through the palm. Our hands do a lot of work, and most people's palms are quite sore, but you can still use firm pressure here. So you've done the hand. Now, as a transition, you do some friction of the arm. Remember, it's always do something specific and then tie it into the limb. Now we're going to petrissage of the forearm. So this is compression, petrissage, first with one hand, with the hand pronated, and then the other hand. So the thumb, or the line of force, crosses the extensor muscles at a different angle. Then supinate the hand. It doesn't matter what order you do these in, it just matters that you've gotten the forearm on both sides in both directions. Then from here we're going to do deep friction with the thumb. So you divide mentally the forearm into 3 segments, and you just make 2 firm strokes through there. Now notice as I do this that the thumb is actually lined up with the wrist. It looks like it's at an angle, but it's actually lined up. So 3 segments on one side, the middle segment on the brachioradialis muscle, and then on the other side again 3 segments. Now it may look like my hand's doing exactly the same thing every time, but in my mind and in my line of pressure, what actually happens on the forearm is this segment, and this segment. So even if it didn't look like it was any different, every time the line of force was in fact different. So we've done kneading and deep specific friction on the forearm. So we do some general friction just to link that whole thing back together. Bring the arm out at a 90-degree angle here, and you're going to compress the biceps. So this would be another form of petrissage, compressing and lifting. And then you'll stand to the side of the table so that you'll use this hand, the outside hand, to do the same thing. We're going to divide the bicep into 3 segments and glide with, this is firm pressure. This is pretty specific therapy through the 3 segments of the bicep. And the reason you use your outer hand is if you tried to use this hand and do that, you'd run into the armpit, and that wouldn't feel good. So you've done that, and so again, you come down, tie the whole thing together. And to do the triceps, we're going to bring the arm up behind, allow the arm to just rest on the hand closest to them, almost just like a hook. And then you're going to do some friction with your whole hand first, because we didn't get a lot of lubricant back here. And then petrissage. And for whatever reason, for me it seems like the petrissage works better in this direction only. So notice with the forearm we went both directions, but I really think this, because you can get some traction on the shoulder, and it just seems like a more natural move. Then the same thing, we divide this into 3 segments, deep friction with the thumb. So there's always a medial segment, an intermediate segment, and a lateral segment. That's true of every one of those. Then we bring the arm back down, do friction of the entire arm. So, and again, notice when I'm doing this friction, I'm bending my knee. I'm not just using my upper body. Then I'm going to traction the arm a little bit and do shaking. This is in the category of vibration, according to Kellogg. So it just helps to relax the proprioceptors of the shoulder. Friction again. And then stroking. You could do digital stroking or palmar stroking. Generally, I tend to do palmar stroking. It's less ticklish. You're done with that arm. Okay.